Along with myself, Lisa, Antlin, Emily, and Jamie, we will all be discussing emphysema today. Emphysema falls under chronic obstructive pulmonary diseases along with bronchitis and asthma. Emphysema involves the respiratory system, in which the lungs ultimately break down and lose their elasticity due to improper airflow from a restricted pulmonary artery. In this chart recorded by the CDC, it shows the age distribution between COPD victims over 18. Results are clearly predicted that age is a risk factor, with the majority being over 45 years of age. Here we also see the prevalence rates of COPD over 18 years of age, but it's evident with the incident rate that income and racial backgrounds are a large factor perpetuating emphysema. The exact cause of emphysema is unknown, but is strongly associated to cigarette smoking. Even so, not all smokers will develop emphysema, suggesting a genetic factor, such as those with a condition that renders them deficient in alpha-1, or AAT, a protein in the blood that allows white blood cells to fight infections, but not damage other tissues. Living in areas with poor air quality, long-term exposure to chemicals, and chronic bronchitis are other possible causes. As the fragile tissues between air sacs are destroyed by toxins such as cigarette smoke, air pockets in the lungs develop, allowing air to become trapped in these spaces of damaged lung tissue, causing the lung to gradually enlarge. This results in more time and more effort for the lungs to be emptied. This process occurs slowly and over years. Spirometry testing is when the patient is asked to breathe in and exhale forcefully into a spirometer instrument. This is repeated several times. The force of the air is then measured. There are a variety of treatments for emphysema. One option is medication use. Medications such as bronchodilators, steroids, and antibiotics, along with vaccines, help in treating emphysema. Bronchodilators can be inhaled as aerosol sprays or taken orally. Steroids can be inhaled as aerosol sprays as well and can relieve symptoms of emphysema associated with asthma or bronchitis. Antibiotics help fight respiratory infections common with people with emphysema. Getting vaccines to prevent infections such as the flu or pneumonia can help patients with emphysema by reducing their chances of complications. In order to prevent, do not smoke, and if you do, quit smoking. This can prevent or slow the progression of emphysema. Limit your exposure to air pollution if possible, and wear respiratory masks if you are exposed to harmful chemicals at work. For those already suffering from emphysema, it is important to stay vaccinated. Vaccinations against influenza and pneumonia can help prevent life-threatening respiratory infections in people with lung disease. Medications such as bronchodilators, steroids, antibiotics can be prescribed by your doctor to control symptoms. Rehabilitation, surgery, and even transplants are sometimes necessary to keep emphysema under control in the more advanced stages of the disease. Some of the objectives of the WHO include strategies surrounding better surveillance to map the magnitude of chronic respiratory diseases and analyze their determinants, mainly with reference to the poor or disadvantaged populations, to monitor future trends. Primary prevention's objectives are to reduce the level of exposure. Secondary and tertiary preventions are to strengthen the healthcare for people with chronic respiratory diseases by identifying cost-effective interventions. Healthy People 2020 goals are set to reduce activity limitations among adults with COPD, reduce deaths, hospitalizations, and reduce emergency department visits for COPD.